Welcome to The Swann's Nest. I'm Dr. Nichole Hardy Swann, and today I'm joined by Troy Rose, SLP with Exploration Kids Therapy. Hi, Troy.
Hi, how are you?
Great. How are you today?
Good.
So, Troy, tell us a little bit about your background.
I am a Western Colorado native. I was born in Montrose. I grew up in Olathe, Colorado, kindergarten all the way through graduating high school. Graduating high school, I went to the University of Northern Colorado, where I went straight through for 6 years, my undergraduate and my master's degree in speech-language pathology. I then needed to move back. I love Western Colorado, so I moved back, and I've been an SLP in Western Colorado ever since.
And SLP means?
Speech-language pathologist.
Love that. We have a lot of jargon in our
Yes,
field.
for sure. And I forget that sometimes. Sometimes parents have to kind of be like, what are you talking about? I'm like, sorry, let me slow down a second.
And because especially there's like levels to being a speech language pathologist too.
Mm-hmm.
Yeah. We were talking earlier about, people getting their SLPA, and that's...
Yeah, an SLPA is a speech-language pathology assistant, which you can get. I thought it was a bachelor's, but then in doing a little bit of research, there are some associate's programs, which I was kind of surprised about, which makes it a lot more accessible, because I run into a lot of times people are like, I love what you're doing, and it seems so cool, but that 6-year commitment for a bachelor's into a master's just feels super overwhelming.
Yeah.
So it is a pathway to get people in and working with kids and the fun parts of being a speech-language pathologist without the time commitment and the school commitment and sometimes the cost commitment of getting that much education.
True. Yeah. No, that sounds like a great way to access and open the door to the field.
Yeah.
Love that. So since we're talking about going to school and all those years, tell me about like your educational journey.
So I went to high school and I was a peer mentor. I worked with kids with disabilities. Like in high school, I would go into that room and be kind of like a student aide. I loved that population and was like, I'm going to be a special education teacher. I went to the University of Northern Colorado initially pursuing special education because I was like, this is what I'm going to do. I'm going to do transition. I'm going to do 18 to 21. I wanted to do job coaching. So I go and I take my special education classes, and I did love them, but there was a class in language development that was taught by Lynn Jakowiak, and I just loved her. I loved the class, and she pulled me aside one day and was like, do you want to do this? And I started Googling it and trying to figure out what exactly it was, and I knew that there were speech therapists, but I didn't really ever consider it as a path. And so after looking into that, I just jumped head first and went all the way through it, and I have loved it ever since. So I was already at the University of Northern Colorado. I finished my undergraduate in audiology and speech language sciences. I applied to all the graduate programs. I really wanted to stay at UNC because I loved it. The professors were just so supportive and so helpful. And I just had built those relationships already. And so I was accepted there, and I finished my master's degree. By the time I finished my master's degree, I was just like, I need to be back home. Greeley was great, but it just wasn't home.
It's not home.
Yeah, this is home.
Yeah. That's awesome. So where did you go from there? Like once you
So I was like, I need to go back, I went to Olathe Elementary School is where I did my internship.
Really going back home.
I did, yes. I really, really did. I went back, lived with the parents for a little bit, saving up, because, I wasn't paid for the internships.
And it's something that a lot of people don't know about that process.
Yeah. So I did, I believe it was 12 weeks in Olathe Elementary School, and I had a great supervisor. I went to, and also I was always kind of kicking around, like I have this idea that I'm a medical a medical speech language pathologist, because there's
Yeah.
kind of those two fields. You can go into pediatrics, and then you can go into more adult rehab, or like people who have strokes and relearn how to talk, and people who maybe have like effects from anesthesia, or people who are going through dementia. And you kind of can treat those people. And I always thought that that was my route, and I kind of kept going back to it, even though every step of the way I was like, I don't know, this working with kids thing is pretty darn cool. But I just had it in my head that but the internships really fixed that. Like being in a setting with kids for 12 weeks versus adults, I was just like, that's where I'm supposed to be.
Yeah.
Yeah.
You can tell if you're meant to work with kids, right away.
Yeah.
When you start working with kids.
Yeah. I think that it really does feel that way. Like there's just a certain, I don't know, it's so much fun, and their energy is just like, it gives you energy. Where for me in the medical field, I felt like I wasn't getting that same, I don't know, like where the kids are saying these funny things and they're running around and they have all of these like super cool questions, and for them everything is so new and so fun all the time.
They have the most curious minds
Yeah.
and say the most fascinating things.
Yeah.
You can walk in not having a great morning, and all of a sudden it turns
Yeah.
like that.
Yeah, for sure.
Yeah. Well, then, so you've talked a little bit about like supervision. Talk about I would love to hear more about like internship and supervision opportunities and what that typically looks like for like a speech pathologist.
Yeah, so as you're a speech language pathologist, you can then take students in. I have not yet had a student. I'm really looking forward to that. I've had many, many shadows. I haven't had a student just yet. But it is something that is so, it's really cool to see a person who's less familiar with the field and just their interest. And like undergraduates have come and just their questions, they're like, well, why do you do this? And it kind of gives you a chance to be like, why do I do that? Let me think about that for a second.
Like that's automated for you. You start to have to
Yeah.
like rationalize it and externalize
Yeah,
that.
and I think that that's really helpful to
Yeah.
kind of like, as you're talking through the why of what you do, whether that's with a parent or with a student or with, an occupational therapist, but it's really helpful to kind of go through the process of talking about why you're doing what you're doing, because sometimes it becomes so automated that you're not so sure, and then it just helps you be more intentional about what you're doing.
I love that. Yeah. So what advice do you have for grad students then who are going through their programs?
I think I would really search out a supervisor who is incredible. I was very lucky. I had a great mentor in the schools and in the medical side too, but just somebody who has so much passion for what they're doing, because it's infectious, and somebody that's just willing to learn and willing to move beyond, because research is changing, ideas are changing.
Quickly.
What works for one kid doesn't work for another kid. What we know this year, we might find out doesn't work next year. Or we might find out we've been doing wrong, which is sometimes like, that's hard, but it happens. Yeah. You find out like this thing that you thought was the most basic is now no longer like the way that we do things. I was like 3 years into being an SLP before I even learned what Gestalt language processing was.
Yeah.
And, it was just like, oh, it's echolalia. And then once you kind of take that deep dive into Gestalt language processing and you use scripting and building those languages and functional scripting, it's like, oh, well, it just opened a door into this population of kids.
I was today years old when I learned what Gestalt language processing.
Yeah.
Oh no, it's like great because like you're absolutely right. Like the research changes our culture around development and neurodiversity changes, and I think that shifts where the research goes and what is being taught. And some of the things that are being taught in grad school now, I never had access to back then. Those are things I independently had to learn and seek out after grad school. So yeah.
Yeah.
And I think having supervisors who are willing and mentors who are willing to meet you where you are. My mentor, Dr. Jeffrey Walden, I mean, he just absolutely changed my life with the way that he was not just so well informed, but where he was able to really meet me where I was and help identify places where I needed to grow while supporting my strengths and utilizing those. It's a special relationship having a mentor.
Yes.
Yeah.
Yeah, for sure. And that continues. I still talk to Miss Linda DeGare. I still talk to her all the time.
I still talk to Dr. Jeffrey.
Yeah, it is. It's so when you're just like, I'm not so it's amazing when you feel a little bit stuck to just have, and now that I'm here, I have also Kelsey. Like we reach out all the time and we talk about like, hey, I have a kid that's doing this, and the things that I have had work every other time isn't working today. And that collaboration is just really it's essential.
Yeah.
Yeah.
And so that's collaborating within like Exploration Kids. So within Exploration Kids therapy, what do you enjoy about like our program and our SLPs?
I love, well, our SLPs, but also all of the people who work here. There's just such a culture of understanding and communication, and everybody just comes to the table equally, and we have these conversations where we hash out like, this is the circumstance and what should we do for this and not even just for kids, sometimes with scheduling or with resource allocation. Like everybody just has a voice, and there's not a lot of personality interference
Yeah.
with the way that kind of the processes work. There's a lot of great communication and a lot of great, like everybody just comes to the table with the goal of helping kids, and it's fabulous.
There's no ego.
Yes.
Yeah. I like that too. I think that like the way that we've tried to kind of structure things is that it reduces that. And the opinions are valid amongst everyone who's kind of part of the organization. And so a lot of times, like I even take a step back. I'm like, y'all get to make this choice.
Yeah.
That has nothing to do with me.
Yeah. Yeah, it does. It's very collaborative.
Yeah. Do you, just speaking about like interests, I know like Kelsey has a different like field experience and different like educational experience, and you like talking about like your field experience and educational experience and being more in the medical space. Like, do you feel like there's a lot of opportunity to learn from people's different like backgrounds and experiences?
Yeah, I do. I think that everybody has worked with different kids, and because of that, they've experienced different variables to child language development. I think that it gives you different perspectives. Like sometimes I'm very, very play-based, as is Kelsey, and sometimes, not that it's like one or the other, but sometimes, a person will be like, hey, like, there is value to this kid as he gets older being able to sit at a desk and work. And that's valid, right? Like if we have a kid that goes to school and they're kind of used to just being able to completely lead the whole time, then sometimes that's a barrier to the way that our education system is set up. So not only is it good for us, I think it's good for kids to work with a bunch of different personalities and a bunch of different kind of individuals with different perspectives, so that they're more well-rounded, and that we're more well-rounded as we get different perspectives from people that go like, this is a value that I have, and we all have different values, and you kind of like mix that into the pot. And
See what happens.
See what happens. Yeah.
The fruits of our labors. Well, I think that that's really interesting. And I was going to ask a question about something else, but I want to just ask you this. With having those different perspectives and those different backgrounds, what does that mean, like, for maybe a mentee, a student coming into the program who wants to get supervision, who wants to get mentorship towards their certification? Like, what does that mean having so many different, like, therapists who have those different backgrounds and perspectives?
Yeah, that's because also something you realize there's not one right answer almost ever.
Right.
And so as you can collaborate with more professionals and different professionals, you start to realize that, like, oh yes, this works, but this works and this works, like
You're filling
modeling.
up your toolbox.
Yeah, exactly. Like modeling works, recasting works, like all of these different strategies. AAC, like some people lean more heavily or less heavily on AAC, but all of these things work.
Mm-hmm.
And it's just which tool is appropriate for that kid. And it's not only what's appropriate for that kid, but in the dynamic of what works between your personality and that kid's personality. And that's different with each kid for you, and it's different for that kid with each adult who works with them.
Capturing that special special thing that, like, allows you to push through and really build rapport and skill. And
yeah, so if you're a student, I would highly suggest reaching out, shadowing, communicating. If you come here, like, I would highly recommend you work with multiple different SLPs, because I think that capturing all of that really helps expand your mind to what's available and what works in the field.
and you're developing your professional identity as you're going through that process, and you just kind of, each supervisor lends you something of their...
You take a little something out of you take a little something you like that every single person you work with does until you build your own toolbox.
I love that about super. I always tell people, don't rush it. Like, enjoy this time. Enjoy, like, soaking in all the knowledge. Just, like, being able to, work under someone's license without any... Like, that's nice. Because once you get your license, you're like, whoa. But I just, like, I love it. It's such an opportunity to, like, really, like, polish who you are and polish what your worldview is and what your clinical skill looks like and your professional identity. Like, it's a great moment. Yeah. Even if you don't get paid. Just kidding. It's just true story. Like, I never got paid when I was in, like, grad school, and I just racked it up one day, and I was like, this is how much money I give people. Grad school is tough, I think, like that, like, financially. We try to do really good, but, like, it's a tough time.
Yeah, it is. And it's in depth, and you're learning so much all at one time, and kind of you aren't quite accustomed to those skills. You haven't built that muscle yet for being consistent and working consistently. And so it's all just very new, and you're like, oh my gosh, this is what I'm gonna have to do for the rest of my life. but no, you build those skills, and you become accustomed to being a little more steady with that workload. And yeah,
I love that. So what are the career paths that you can take within speech language pathology?
Within speech language pathology, there's an SLPA, which is kind of the entry level position. That would be associate's degree or a bachelor's degree.
Okay.
And you can work with the kids. You just don't do assessments.
Okay.
So you work under an SLP. You can do all of the, like, day-to-day. You work with the kids. You use all of the techniques for language development. But you have an SLP cosign off of your notes, and you don't do evaluations. You can be a speech language pathologist, which is a master's degree and a professional license. You then can assess kids. You can
Supervise.
supervise. Yeah, you can supervise students. You can supervise SLPAs. So you can specialize in, there's language development. Through ASHA, there's also different kind of external credentialing bodies where you can take different specialty courses or be certified in different things. But through ASHA, there's language development, there's dysphagia swallowing, cognitive communication, post TBI.
So we've talked about the specializations and the certifications. Where do you think the field of speech language pathology is going?
Since I've been an SLP, I see a big push towards using AACs, not just for long-term users, but kind of kids through early intervention, and they might be kids that don't use a device long-term, and kind of having the stigma of being a device user going away or minimalizing to where like we're using this as a tool and not something that's only used in last resorts, where I think that's kind of a block that I had as a professional when I started, was that when we had kids that were completely nonverbal, I would go, okay, this is we need something so that they can communicate, where if they were using some words, we'd go, okay, well, now they're a language user and we use that. And thinking of it very black and white. And I'm seeing through professional development and things like that, I'm seeing a big push towards using these devices more as a tool to build language and total communication, whether that be sign language, verbal language, using the AAC, and just building their language as a whole.
So for anyone who doesn't know, AAC is
Alternative augmentative device.
Yeah.
It's a device. Sometimes it's like literally an iPad, and sometimes it just kind of looks like a really thick iPad.
Yeah.
And they have different icons with words on them that kids can navigate through, and it's really incredible. Like when you watch a kid scroll and find the word, it's amazing.
Yes. And you can strap it on and take it with you everywhere.
Yeah.
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 And you can personalize the devices too.
Yep.
Yeah.
Mm-hmm. So if you have a kid that's like eats, I don't know, Cheerios, you can just go in there. There's a camera on most of them. You take a picture of their Cheerios, you add it into the device, and then they can scroll through there. They have all their foods. They see their Cheerios. Bam.
Boom.
Give me
Now
those
I'm thinking about
Cheerios.
cereal.
Yeah.
Oh, yes. And you can do like pictures of like family members and all kinds of things.
Yeah, there's like clip art type icons for a lot of the things, and then you can also take pictures of the actual person, place, or thing.
Mm-hmm. I tell parents a lot, like what a like amazing time when to like if your child is going to have or be diagnosed with some kind of like delay in like speech or development. What an amazing time to have access to all of these things that we have and the services that we have. This was not something that was at all available like when I was going through grad school, and to be able to personalize it and customize it so that it's so specific and it's like can be utilized by a child in such a very like personal way.
Mm-hmm. Yeah, I don't have really anything to add to that. You kind of hit the nail on the head. It's amazing.
It's amazing.
Yeah.
And you can, I feel like as a professional, like it makes you feel like, gosh, like what an awesome like ability to be able to give this child to help them have a voice.
And to the families, like there's so many families that are just, they're frustrated because they know that their kid is understanding things, but they're just not talking.
Mm-hmm.
And a lot of families feel like, gosh, I know that they can do this, and I know that they know what they want. I just don't know what they want.
Yeah. I see that a lot, like when we're doing evaluations and we're doing like IQ testing. I wish so much that we could have some normative data for AAC users and alternative language users, because that would be so special, because I see the same thing. It's like the expressive language is just not as developed as the receptive language, which Dr. Walden told me that would be the case when I had my first child in grad school. Watch Watch your language. Receptive develops before expressive.
Yeah.
But I mean, like, there's so many times where I feel like I know this kid wants to communicate or wants to tell me, and they just can't quite find like the word.
And then oftentimes that leads to frustration,
Yeah.
understandably so, because they're not able to get their needs met. And then there are behaviors that's kind of what people focus in on, are these behaviors, when the root cause of that a lot of time is a lack of language.
Yeah. And it's
And
just a communication issue.
it is super frustrating. I sometimes I'll take like the trial devices home, and with my fiance, I'll just go through and try to communicate exclusively with a device. And it's frustrating, like the time that it takes to scroll through, and I can't quite find the icon that I'm looking for. And I know it's not like a one-to-one, but you kind of get a glimpse into that frustration of knowing what you're trying to say and not being able to get it out into the world.
Yeah. I think one of the things that we try to focus on, and I think what like Kelsey and I have like tried to bring over, is about just like this dignity and this neurodiversity affirming perspective. And I think inherently every clinician comes into the field wanting to like do that.
Mm-hmm.
And there's this evolution that happens, I think, as a clinician, where you start to employ that even in a more thoughtful kind of way. And one of the big things that I always push for, and it's a frustration that I think sounds like you and I share, is that recognizing that a child's voice is so important, and they should have access to that everywhere. And with the field of speech kind of being like the old guard saying, well, you have some words, you don't need the device, like we can, like, what are your thoughts about that? Because I think that, like, yeah.
I think that idea still exists. I think when they're able to see it, that changes. And I think that that's true for me too. Like, I had a kid that was nonverbal, and I was like, oh, I'm gonna get him a device. When I was, brand new SLP, I need to get this kid a device. And then you start watching them use it, and you go, I need to learn everything I can about this.
All of it.
And yeah, I think that that's something, kind of going back to EKT, like that's something that has been super cool, is that so in the culture of everything. It's a focus, but it becomes something that you just do because everyone is doing it. That neurodiversity affirming, and like it just becomes, it's not something that you have to do so intentionally when everyone is doing it.
Right. You love that. I'm going to shift gears real quick and ask you, so native to Western Colorado.
Yes.
What do you love about this area?
I love the outdoor recreation. We're, depending on where in Western Colorado, but we have skiing. If you love skiing, there's so many different, Crested Butte, Telluride, Powderhorn, skiing, snowboarding type activities, hiking, hunting, fishing. ATVs, yeah. If you need to get in the mountains, you are right there.
Yeah.
And also just there's a calmness to the Western Slope that when I get out of that, I feel like my brain is firing so fast.
100%.
It's just it's just like a small town atmosphere of hardworking people who care so much about their kids.
In their community.
Yeah, there's just like such a big family community focus, and it just makes it really easy on me to start implementing these strategies because they all care so much and they are all so family oriented.
What are you doing this weekend?
This weekend, the fall festival for Families Plus. Yeah, I'm really excited about it. Yeah, family resource fairs. There's one in Gunnison next month. Like, yeah, it's amazing. There's just so many events. Everything is focused towards family. Like there's not really a lot of, I don't know, adult only type activity. Like everything is very focused towards kids and family.
Yeah, it's great. Like I love the agricultural element. Like it's right there
Yeah.
when you're driving down the like down the road. Like
Yeah.
you're surrounded by cornfields and
It drives everybody that rides with me crazy because I'll be like, yeah, but I know a way that we can go where we're not on the road, like on the highway. And they're like, that's longer. And I'm like, yeah, but
it's
like,
prettier.
we don't have to just see cars. We can see-
Exactly. We went the back way from like Olathe through to Telluride one
Yeah.
time. It was so gorgeous.
Yeah, I know. I every time I try to convince everybody, like, I know a better way.
I
Like,
would rather go the long way than sit in traffic.
yeah, me too.
Like, don't you, when you go to a big city now, aren't you like, ugh.
Yes. And everything is just so fast. Everybody wants to get there so quickly, and I'm like, it's not for me.
Not for me either. Yeah. I grew up on a dirt road. I'm like, please do not put me next to a neighbor. If we can't be naked in the fields, what are we doing here? It's true. I don't think my kids wore clothes until they were 6.
There is some truth. Like I feel kind of the same way. I was so nervous about like living in a subdivision.
Yeah.
Because I was like, I'm gonna have neighbors, but it's so like going back to like so community, so welcoming, I guess, and very like we just do our own thing.
You know people, like when you go out, there's not a sense that you have to interact, but like you go out and you see familiar faces.
All the time.
All the time.
In fact, I feel like when I go somewhere and I don't know anybody, I'm like, am I going crazy?
Is it tourist season? The locals left. No, I love that. And you have your favorite restaurants and you're like, people will go out of their way for you just like because you're local and you're part of the community. And I think it's great.
Yeah.
The idea of having to go over Bale Pass just like stresses me out. Going towards Denver, I can't do it.
Yeah. Yeah. I feel the same way. Just like, I feel like I joke with Abby that if I lived in Denver, our DoorDash bill would be through the roof because just having to drive somewhere to go pick up food is crazy to me.
Crazy.
I have to get on the highway to buy food.
No, thank you.
Yeah.
No, thank you. Well, I think too, like what's so nice about being out here is like you also know the players, like your like fellow clinicians, the local pediatricians, the local teachers, the school board, the early interventionists. I mean, it just like everyone. So your referral sources and your cohort, you can just pick up your phone and call their cell phone and like.
And because people, it helps it feel like we're all on the same team.
Yes.
And we're not an entity that is trying to cause them some kind of harm or that we're insinuating that they're doing something wrong.
Dropping the ball.
Yeah, you can just kind of be like, hey, I need this. And they're like, oh, okay, cool.
But you can piece things together. Maybe they know something that you don't and you know something they don't. And so it helps create, I think, a more cohesive like treatment program. And I think like for me, like getting to follow up on those things, like I'm like, really, I think genetics needs to be involved or something like this. Like just call them up and be like, have you noticed this? And it's just great. It's just really great. Yeah. And the parents really well.
Yes. Mm-hmm. And even if you don't know them at first, like, because it's so like in the culture of the community that it's so family oriented, as soon as you do know them, you know them.
And then you see them everywhere.
Yeah, exactly.
I think it just brings up such an interesting conversation like I was having with someone the other day. Is like being a small town practitioner, like being a practitioner in a community where you live or live next to, like it offers different opportunities and boundaries look different. And it's such a great space to actually, if you're not planning to stay in a small town, but experience and working in a small town is so important because it teaches you about those things.
Yeah, exactly.
That's really cool. Let's debunk some myths. What do you think?
Cool. I think, ooh,
So debunking myths. What's a myth that you've heard of in speech?
a big one that we get a lot with parents is I was going to wait to get a referral until they turn 3.
Oh, yes. Let's do that one.
They're not talking yet, but I'm thinking about waiting until they turn 3, to just see if there's really a problem here. And the analogy I always use is it's like, if a kid is at a 50% delay at 2, they're a year behind. At 3, they're a year and a half behind. And the longer we go, the more ground we have to make up. And it's so much easier the earlier we have kids come in and get those early intervention services. It's kind of like if you're at the gym, like if you decide I'm going to start working out because I am not loving something, then it's a lot easier to make that up than when your doctor's telling you, like, you need to go to the gym. Yeah, like it's just the gap is not as wide. And we can close that a lot easier when a kid is young if you're noticing that there's a delay.
Yeah, I think that's a great one. Well, then in that same vein, frequency of therapies, because a lot of the parents that I chat with when we're doing like our evaluations, they'll say, oh, we don't need outside speech because we're getting speech in school.
Yep, we get that one. I would say I also worked in the schools.
Yeah.
The school services are awesome. That's an awesome program. I love that that's available to our kids. First of all, yes, if they're then coming to private speech, they're getting that service times 2. And also, there's sometimes an academic focus to those services where we're able to take more of an ADL / like life approach to, well, we can talk about your hobbies. It's not so, and not that it's like one or the other, but it's not so focused on reading, writing, literacy.
Because kids are more than just students. They're kids outside of the school too.
Yep, exactly.
Yeah. So the goals that they should have shouldn't just pertain to academic success.
Yep. Oh, another. I feel like I have a million myths. What's another one?
I think one, do you mind?
Yeah.
I think one that we kind of touched on already involves the AAC devices.
Yes.
And so, like at Swann Clinic, when we kind of bring that subject up about starting with a device, a lot of parents worry or will forego that service because they don't want the device to replace their kids being able to learn to speak.
Yes. That's a great one.
Yeah, so I don't want my kid to use a device because then they won't learn to speak.
Yeah, there is no. I just thought of another one, but yeah, we'll do that one first. ABD. There's no research to support that the use of AAC interferes with kids using or developing verbal language. It's a tool, and it helps kids communicate in that moment as they are and develop language in the future, whether that be through the device or verbal. Yeah, it's just the more that I learn about AAC, the more I'm convinced of its abilities for multiple different populations of kiddos and building the language over time.
Yeah.
Another one is for bilingual families that we're seeing a little bit of a speech delay, so we stopped speaking Spanish because we don't want to confuse them trying to learn 2 languages at once. that's another area where there's no research to support that at all. If you are a bilingual family, talk to those kids in both languages. Language development is language development, and it's not specific to which language they're speaking.
Question. If you have a language disorder in one language, do you have it in the other?
Yes.
So
If a kid is, most of the bilingual families that we see are English Spanish, so I'll use that as the example. But if a kid is not experiencing a language disorder in Spanish, but they are in English, that indicates that they have a language difference, which means that they are just learning English and they haven't quite got it. If it's in both languages, then that indicates that it's a language disorder, meaning they're delayed in their language development.
I just learned something new today. That's amazing.
So really for our bilingual kids, it's best practice to have them assessed in English and Spanish, because if you see kind of those results, that would be like if you gave me a language test in Spanish, you would be like, oh, this guy needs some services, but really it's just that I'm not a Spanish speaker. But if I took the test in both English and Spanish and I was delayed in both of those, that would indicate that I have maybe a limited vocabulary or a language disorder.
That's awesome to know. That's really great information. I think, so my kids attend a bilingual school, and they rotate the subjects
That's
through
so
the
cool.
languages. Yeah, so they get like part of the day in English and part of the day in Spanish. And so they're getting math and social studies and all those things in Spanish too. And one of the things that I see parents asking about is, you know, is this going to impact their grades? And how long does that impact last? One of the things that I kind of point to is the literature is super clear that you see scores that are a little suppressed when they're younger, and you might see a slight like delay when compared to the norm. But once we hit about high school, having that dual language instruction, they just take off. Like their scores go up exponentially. They have access to so much more than their single language peers.
Yeah. And I mean, really, if you look at the whole child, even if it was equal, the benefit of being bilingual far suppresses a little bit of a later start.
I agree. Yeah.
Yeah. I mean, it's just such a tool in communicating with multiple people and being, like culturally too, being tied to your community, being a bilingual individual, as opposed to, stopping that because you're worried that it's going to impact their language delay.
Can I say that's one of the things I love most about Western Colorado, though? I love the culture here. I love the fluidity between our Latino community and, just like, it's just so wonderful because there's just such a special like feeling of just being so integrated. I now know how to make pozole. I made it for Christmas last year.
Cool.
But like, I feel like my kids get such an access to a diverse like community that I never had access to. And I love this community, like the warmth and the culture and the like celebration of it all. And I also love helping create something that resembles like parity between the services for the kids.
Yeah.
I think that's so important.
Yeah, for sure. It's so important, and it's one of those things that it's such an important variable, especially like going back to speech. I had a little one that, when you're kind of trying to pick up what's babbling and what's, and she was like just chatting away, and then I was like, like she's saying that a lot. I don't know what that means. I'm like thinking, like what word you're trying to decode 2-year-old speak. You're trying to decode it, and then you're like, oh, that's yellow, and amarillo.
Amarillo.
And I just was, yeah, it is. It's, and again, going back to like, it's the part of the culture of Western Colorado, it's so family oriented, and so are our Hispanic communities. Like, they love, love, love their families, and they would do anything for their families. And sometimes sometimes culturally, they're a little nervous about getting those services, but once they're in, because they would do anything for their kids.
Yeah. Yeah, I totally agree. I totally agree. And I'd love to bridge that barrier and just,
Yeah,
help make that just more of a natural process.
for sure.
So, Troy, thank you so much for being here today
No problem.
at Exploration Kids Therapy, where you are every day.
Yeah, it's not a problem.
But I'm so glad we got to do this together. I have so much respect for you. I appreciate you and all your hot takes and just wealth of knowledge.
Cool. Thank you.
Thank you.